How self-control and emotion regulation relate to addiction. In most scenarios, addiction may be a response to certain emotional stimulations that exert one's control. This is printed in the Stages of Recovery Addiction Services. Understanding emotion regulation. Self-control and emotion regulation have an essential impact on people struggling with substance use disorder. Impairment of control is a common defining feature of addiction, but certain individuals may also try exerting control. What is emotional dysregulation? Understanding self-regulation is essential to help control cravings or urges that may affect one's mental health or lead to addiction. For individuals going through rehab, emotion regulation can also help recovery and reduce chances of relapse. What is emotional dysregulation? Emotional dysregulation describes the inability to control or manage one's emotional responses. Individuals experiencing dysregulation typically face challenges in keeping reactions within an acceptable range of emotions. Examples include feelings of frustration, sadness, or anger. When a person experiences dysregulation, it may result in substance abuse and behavioral changes. Addiction relates to dysregulation because of the inability to cope with emotions in healthy and productive methods. Due to the effects of emotional dysregulation, it is imperative to develop helpful management abilities. The 3 dimensions of affective temperament and behavior. There are 3 dimensions of affective temperament and behavior with their significance to overall mental wellness. Here's what to learn about the different dimensions. Negative affect. This dimension describes individuals with a stable tendency to feel negative emotions. People with high negative affectivity, NA, are likely to experience negative mood states regardless of their condition. NA may include several negative emotions, which are disgust, guilt, fear, anger, and contempt. Individuals with low NA are typically calm and serene. Positive affect. Unlike the NA, positive affectivity describes how much humans experience positive affects. Individuals characterized by this dimension are usually energetic, alert, and enthusiastic. Positive affect promotes sociability, helpfulness, and open-minded behavior. Low levels of positive affect typically describe poor emotional health, depression, and social anxiety. Effortful control. Effortful control primarily applies to children. It describes the ability to willfully manage attention and inhibit behavioral responses for emotion regulation and related behaviors. In children, effortful control connects to difficulties in regulating negative emotions like sadness and anger. Emotion regulation subsumes certain abilities. It is essential to comprehend each of them. Awareness of emotions. An important step in emotion regulation is the ability for individuals to identify their feelings. It helps with appropriately expressing all kinds of emotions. If you suppress this is my addition. If you suppress this through believing that toxic positivity is healthy, you deny the possibility to even be aware of this. Identifying and categorizing emotions. At every moment, individuals need to learn to recognize and classify their emotions. In some cases, physical symptoms may be valid clues to identify and categorize how an individual feels. Interpreting emotions. After proper identification and classification, it's important to name the feeling. The individuals should interpret whether it's a feeling of anger, disappointment, resentment, anger, or sadness. Note that dialectical behavioral therapy, DBT, may help in interpreting emotions. Addictions. These emotions are normal responses to situations. Feeling certain emotions does not always signify a psychological disorder. So it's acceptable to feel angry, scared, or irritated. Individuals should try practicing self-compassion and understand that their emotions are valid. Enduring negative emotions. Enduring negative emotions is a technique of handling feelings by embracing them. It also involves understanding the reasons behind such emotions. Enduring these emotions may serve as one of the helpful stress relief techniques to avoid allowing the feelings to become overwhelming. What is self-control? Self-control describes the ability to exert control over one's emotions, thoughts, and behavior in difficult scenarios. It also describes applying techniques of control during times of impulse or severe instances of temptation. Self-control is an executive function and a cognitive process important for the regulation of individual behaviors to achieve specific goals. Common goals relating to self-regulation include efforts to stop substance use disorder, constant exercising, and healthy eating. Note that self-control is synonymous with willpower, fortitude, determination, and grit. According to the 2011 Stress in America survey by the American Psychological Association, 27% of respondents showed a lack of willpower as a main factor hindering their goals. A high percentage of individuals, 71%, also believe they could learn and strengthen self-control. In most cases, saying why is just stopping not the solution? Just stopping is not a viable solution for most individuals experiencing substance use disorder. In most cases, this factor is due to the physical dependence people develop after substance intake for a significant time. When an individual just stops using these substances, they suffer from certain physical withdrawal symptoms. Examples of these signs include sweating, nausea, muscle pain, and congestion. Apart from the physical dependence substances cause, individuals also develop psychological dependence. Hence, symptoms such as depression and anxiety. Both physical and psychological withdrawal symptoms typically develop when an individual stops a substance. The symptoms may cause a relapse with or return to use without DBT or other necessary treatment procedures. How to get control over urges and cravings. As an individual experiencing substance use disorder, there are helpful ways to gain control over cravings and urges, including steps like build. The first step to controlling urges and cravings is building up controlling behavior. In this step, it takes consistency. To be successful in building up to controlling urges and cravings, practicing mindfulness may help build this ability to control behavior. Development is a stage of growth and control. During development, it's imperative to develop these controlling behaviors, and it's typically helpful for individuals in recovery to avoid relapse. Creating mechanisms that support control. It may involve an individual's attitude of stalling, distracting, and resisting urges through certain techniques. When tense, individuals may consider helping relaxing techniques for better well-being. Learn. With an idea of a working method for gaining control over urges, one must keep learning helpful techniques. Examples include getting a hobby and understanding triggers. It's imperative to learn meditation benefits for overall health and better control. For individuals with substance use disorder, there's a helpful procedures for dual diagnosis mental health professionals. And here's some significant preventive strategies. In most scenarios, the preventive strategies typically apply to adolescents or young adults. And most young adults have higher risks of drug use, especially in the period of transition. For this reason, mental health professionals may recommend certain research-based prevention programs. Behavioral therapies. The goal of behavioral therapies is to help individuals experiencing substance use disorder to remain abstinent and modify their behaviors towards addiction. With behavioral therapies like DBT, individuals can learn how to evaluate their thoughts and beliefs. The therapy sessions might also help individuals develop new ways of solving old problems. MAT. MAT means medicated assisted treatment. Focuses on the use of medications alongside counseling and behavioral therapies if you're lucky in Florida and other places. According to research, the combination of therapy and medication can be efficient for treating addiction. Mental health professionals typically consider meditation benefits alongside medications. Be very careful with treatments you choose. Many are related to a lot of fraud. This is my addition. Such as urine testing and keeping people on MAT for as long as they can to milk their insurance for all the money they can. This is more than not typical, unfortunately, in places like Florida.